Hello friends, welcome back to my channel Need Those. In today's video, we are going to discuss about clavicle bone of upper limb. Clavicle. Clavicle is also known as collarbone. Clavicle is a bone with slightly S-shaped curve located at anterior aspect of body at the junction of root of neck and trunk. And clavicle articulates with sternum and first rib cartilage. It also articulates laterally with acromion process of scapula, and clavicle is the only bony attachment between trunk and the upper limb. Now let us discuss the peculiarities of clavicle. Clavicle is the only long bone that lies horizontally in position. It is completely subcutaneous throughout its extent and can be palpable. No medullary cavity is present in the clavicle, and it is the first bone to stop ossify and the last bone to complete its ossification in our body. Clavicle is the long bone that ossifies by the two primary centers, its unique character. And it has membranocartilaginous ossification, where the lateral end is ossified by the membrane and the medial end by the cartilage. Clavicle gets pierced through and through by the cutaneous nerve. Now let us discuss about the functions of clavicle. Clavicle acts as a stirrup for holding upper limb far away from the trunk so that it can move freely, and it enables the functions like holding and catching any objects. And clavicle transmits forces from upper limb to the axial skeleton. Clavicle provides an area for muscle attachments. These are the functions of clavicle. Now let us discuss about the parts of clavicle. Clavicle consists of three parts, which are two ends, that is medial and lateral, and a shaft. Coming to the image, this is the clavicular bone, and this is the medial or sternal end with sternal facet on each bone, and this is the shaft of clavicle, and the inferior surface of clavicle contains subclavian groove, and acromial or lateral end contains acromial facet. By these three parts, which are acromial end, medial end, and the subclavian groove of shaft, we can decide the side determination of clavicle. Coming to the lateral end or acromial end, it is flattened above and downward. Oval facet on this end articulates with facet on medial margin of acromion to form acromial acroclavicular joint, and this is the acromial facet of clavicular bone articulates with acromion process of scapula to form acromioclavicular joint as indicated in the image. Now let us discuss about medial end or sternal end. This is the enlarged quadrilateral with saddle-shaped articular surface that articulates with clavicular notch of manubrium sterni to form sternoclavicular joint, and this end provides attachment to the fibrous capsule articular disc or interclavicular ligament. Coming to the image, this is the articular disc formed between clavicle and manubrium sterni, and this is the first rib, and these provide attachment to the fibrous capsule of acromioclavicular joint. Now coming to the shaft of clavicle. Clavicle is curved in shape, and it is divided into two parts, which are medial 2/3 and a lateral 1/3. And the lateral 1/3 is concave forward shape, and the medial 2/3 is convex forward shape. Now let us discuss about lateral 1/3 of shaft. It is flattened from above and downward. It consists of two surfaces and two borders, and the two surfaces are superior surface and inferior surface, whereas the borders are anterior border and the posterior border. Here the superior surface, it is completely subcutaneous between attachments of deltoid and trapezius muscles, whereas the inferior surface it presents trapezoid ridge and conoid tubercle, where the inferior surface presents trapezoid ridge and conoid tubercle because this conoid part and the trapezoid parts forms the coracoclavicular ligament, and conoid tubercle located on inferior surface near the posterior border at junction of lateral 1/4 and the medial 3/4 of the clavicle. Conoid tubercle. Now coming to trapezoid line or trapezoid ridge. This is extended forward laterally from conoid tubercle. This is the conoid tubercle and it extends laterally forward. This is the trapezoid line or trapezoid ridge. This is the conoid tubercle. Now let us discuss about anterior border of clavicle. This anterior border it is concave forward and gives origin to deltoid muscle, and deltoid tubercle is also present in the anterior border of clavicle. Coming to posterior border, it is convex border backward, it is convex backward, and the trapezius muscle gets inserted here. Trapezius muscle gets inserted in the posterior border. Now let us discuss about medial two-third of clavicle. It is cylindrical in shape. It has four surfaces. Those are anterior, posterior, superior and inferior. Anterior surface. Coming to anterior surface, it is convex forward and gives, this is the anterior surface, and it gives origin to clavicular head of pectoralis major muscle. It gives origin to clavicular head of pectoralis major muscle, and this is the coming to posterior surface. It gives origin to clavicular head of sternohyoid muscle near its medial end. This is the sternohyoid muscle which is originating it here, and the lateral part of posterior surface is related to the cerviculo-axillary canal, and it is related to the following structures like trunks of brachial plexus and the third part of subclavian artery, which will be discussed in the lateral further videos. It is concave in back, concave backward, forms anterior boundary of cervicoaxillary canal, and the coming to superior surface is mostly important to it gives origin to clavicular head of sternocleidomastoid muscle. It gives origin to sternocleidomastoid muscle from the medial half of superior surface. From medial half of the superior surface, it gives origin to clavicular head of sternocleidomastoid muscle. And coming to discussion of inferior surface, it contains four parts, where first one is the nutrient foramen of clavicle. The nutrient foramen of clavicle is located on the lateral end of subclavian groove. This is the subclavian groove as we know, and the lateral end of subclavian groove contains the nutrient foramen of clavicle. Clavipectoral fascia. It is attached to the margins of subclavian groove. The clavipectoral fascia is attached to the lateral margins of the subclavian groove, whereas the muscles and ligaments are also attached, and the muscle is subclavius muscle. Subclavius muscle is inserted into the subclavian groove at the inferior surface. The subclavius muscle gets inserted into the subclavian groove from the inferior surface, and the ligaments like costoclavicular ligament attaches to the oval impression on the medial end. Here, this is the oval impression at the medial end where the costoclavicular ligament attaches. Now, let us discuss about the ossification of clavicle. Ossification centers of clavicle are four, and those are Two are the primary centers present in the shaft and two are secondary centers, where the two primary centers and each one for the medial and the lateral part present in the shaft, and one is for the sternal end and another secondary center for the acromial end. Acromial end secondary center will be occasional, and the time of appearance or the start of ossification for two primary centers of shaft are 5 to 6 weeks of intrauterine life, and the time of ossification of or initiation of ossification for the secondary center at sternal end is the 9 to 20 years. It will be 2 years earlier in case of females, and the secondary center at the acromial end is 20th year is the year of ossification, and the time of fusion or the end of ossification for the two primary centers is 45th day of intrauterine life. It is the 25th year in case of secondary center at the sternal end, and the secondary center at the acromial end it fuses immediately. Now, coming to the clinical aspects of clavicle, and mostly two congenital anomalies of clavicle are discussed in this video, which are clavicular dysostosis, which is the medial and the lateral parts of clavicle remain separate due to non-union of two primary centers of ossification, and the other is cleidocranial dysostosis, which is the partial or complete absence of clavicle associated with defective ossification of in skull bones, and the most important is the fracture of clavicle, where the clavicle is the commonly fractured bone in the body, and it commonly fractures at the junction of lateral 1/3 and the medial 2/3 of clavicle. This is the most frequent to occur fracture because this is the weakest site and the two curvatures of the clavicle meet at this site, and the transmission of forces from the scapula occur at this site through the costoclavicular ligament. This is the most weakest site, so most fracture will be occurred at the junction of lateral 1/3 and medial 2/3, and the causes may be when a person falls on outstretched hand or the shoulder, outstretched hand or outstretched shoulder, the indirect forces and it gets blows to the shoulder so that the clavicle gets fractured. And when the clavicle gets fractured, the lateral fragment of the clavicle is displaced downward by the weight of upper limb because the trapezius alone is unable to support the weight of complete the upper limb. In addition, the lateral fragment is also drawn medially by the shoulder adductors like teres major, etc., which will be discussed in the later parts, and the medial fragment of the clavicle is slightly elevated from its normal position by the sternocleidomastoid muscle, and when a person comes with a fracture of clavicle, he will be coming to the hospitals by holding his sagging upper limb with opposite hand. These are the characteristic feature of fracture of clavicle. This is completion of this video. Thank you, and let us meet in the next video. Till then, stay tuned and bye.